every patient that walks through that door is going to need an education. We realize that already. We know that it's not going to be like it used to be years and years ago, where patients would come in, they would get assessed, and they'd get put on a schedule and move forward. There's a lot more going on now. Things are a lot more advanced. We use what I like to call optimization. So every patient that walks through that door, not all of them are going to be surgical candidates. But the beauty of what we do, and I think what we do honestly, in my opinion, I think we do it better than anybody else, is we take the time to assess each patient and talk about what is involved in this optimization process. Obviously, we're talking about getting a patient prepared medically for the procedure. If their donor hair, their hair that they're going to use for the transplant, is not up to par, maybe it could be better. What we're looking to do is educate them on what they can do to reach that goal. And now we have other tools in our toolbox, whether it be specific injectables or, of course, the continued use of finasteride, minoxidil. One of the bigger changes, of course, has been the use of those medicines in combination. I'm seeing patients come back, and I'm really floored by how much better the results were. It allowed us to really think about the fact that we don't have to just use a standard type of dosing regimen. With these medicines, we don't have to put everybody on 1 milligram of finasteride. Not everybody has to use 5 milligrams of minoxidil. We can adjust this, we can work it. And honestly, I haven't had a patient yet that we haven't been able to, with the proper dosing, get them to where they're in a place where they're comfortable, at least with the idea of using the medicine. And then we find from there, it may be a little slower, but we're finding that the benefits are still present. So that's been a big change. So I think our philosophy is to not necessarily look at every patient as somebody that you're looking to throw in the chair. That's not it. Their hair, because they're having problems with their hair, they want to know what are their options. It may be easy. It may be that patient's already been on medication for some time, but you can still help to adjust it and make it even a little bit better. But that's, something that you would discuss as you go along.